So in Queensland, there's two ways of accessing a surgical termination at present. The first route is via your general practitioner. So the patient would need to go and see their GP for a referral to their local public hospital for a termination. Now, for that referral, that will involve first the patient going to an external provider to get ultrasound confirmation of their gestation. And as well as that, they will need some blood tests to be performed before the procedure and possibly some STI screening. And once that's occurred, the GP then has the information that will allow them to do the referral to the public system. Once the patient is in the public system, that's when the discussion and decision will be made actually between a medical or a surgical termination. Unfortunately, that process can still be a little bit lengthy and take a couple of weeks to get through due to the number of steps involved, and is also reliant on the capacity of the service provision at the patient's local public hospital. So the alternative is for the patient to refer themselves to a provider. So they don't need to go and see a GP at all. They can just self-refer themselves to an organisation such as Marie Stopes. So this does enable them to have full convenience of choosing as and when they have their procedure. They will have an ultrasound done on the day of the procedure, as well as any blood tests or STI screening. So essentially it's a very streamlined process by this route, where everything is sort of done as a one-stop shop. This does come, of course, at the disadvantage of a cost, which approximately presently sits at around $500. Due to the capacity issues and some of the choices with some of the public hospitals, the other route that we are now seeing is that where some of our public patients who have been referred to their public hospital are actually being funded to then have their procedure at a private specialist facility like ours. So this enables the patient to still receive the benefits that they would by being a public patient, but with the advantage of it being done at a specialist centre, and that also then offloads the workload for the public hospitals, who are, of course, dealing with, in addition, their routine obstetric and gynaecological work.
One of the ways of accessing medical abortion that has been available for a little while is via telehealth. So in other words, telehealth involves the consultations taking place by phone or video link, and then different arrangements happening for the prescribing. So that's been available in Australia for a little while, but hasn't been in the past subsidised by, so it's basically women need to pay a private cost, hasn't been subsidised by Medicare. Interestingly, one of the many sort of things that have come out of COVID, unexpected things and actual potential benefits that have come out of the pandemic, the COVID pandemic, has been that telehealth has been more broadly available for GPs for their patients. And medical abortion is available via telehealth, at least currently under the pandemic item numbers. And there's certainly a strong push currently to see that that's something that should be available in all states under the MBS, so a Medicare item number, into the future for those women who geographically or for other reasons aren't able to directly go in and see their GP. One of the things about access that worries me is when deliberate misinformation is given, and I think that that's probably less the case now we have a greater clarity about legislation around abortion in Queensland. But there are still women who are told that they can't have it, that it's not available when it is.
So since the decriminalisation legislation law reform went through in 2017, it is now mandatory that any doctor or any health practitioner who has a conscientious objection to abortion must announce that, must acknowledge that to the patients, and rather than refuse service or refuse advice, is mandated to refer that patient to a colleague who is known to be sympathetic to the woman seeking an abortion.
So it's important to have information, and then it's about making sure that there are providers geographically as well as within local suburbs, local areas, or ideally within each general practice.